Hi, welcome to our podcast. Today we will be presenting our public health service announcement on the topic of vaccines. Vaccination is one of the most important steps one can take to not only protect themselves but also their children against acquiring ill health. According to the World Health Organization, each year vaccination prevents 2 to 3 million deaths in all age groups. Since the beginning of administering vaccines, diseases such as smallpox, polio, and tetanus, all of which have previously disabled millions of people, have now been eradicated, or their cases are very rarely seen. For example, in a study, the RHEV vaccine was found to be significantly effective in the prevention of hepatitis E. Between those that received a dose of the placebo or the vaccine, those who received the vaccine displayed an 89.9% efficacy over 100-day interval surveillance.
Nonetheless, vaccinations are one of the most successful and cost-effective public health interventions. However, they are limited across the globe, especially in third world countries due to being undervalued and safety concerns. Vaccinations are not valued across the global scale. In fact, the worldwide average vaccination coverage of children decreased from 80% in 1990 to 75% in 1999, and 1 in every 4 children remain without immunization against the diseases covered by EPI. For those who do not know which diseases these are, they are measles, polio, pertussis, diphtheria, tetanus, and tuberculosis. Therefore, if global vaccination can not only be improved but valued more through the education of their safety and effectiveness, an additional 1.5 million deaths can be avoided.
It is important to educate the public about the safety of vaccines, especially parents who are immediately hit with the challenge of determining what is best for their children. There have been many concerns that have caused 1 in every 8 parents to refuse at least one vaccine recommended by their children's physician. Most of the time, this was due to concerns between giving one vaccine over another, the vaccine being newly developed or causing more harm than one would receive without receiving the disease. However, these concerns have been addressed in the literature that many people are not exposed to. For example, it has been proven that the risk of complication after natural disease is much greater than the risk after vaccination.
Similarly, many people are unaware of the importance and impacts of herd immunity. Herd immunity is the rate in which a contagious disease spreads depending on the amount of vaccination within a population. The higher levels of vaccination, the less of a probability it is to acquire disease, and at times the probability can reach 0. With this being said, valuing and understanding the efficacy and safety of vaccines is very important, as it is one of the most effective public health interventions that can save millions of lives across the globe. Thank you for listening.